Over the past year, loved ones may begin to show subtle, yet concerning changes that cause worry. Many tend to believe that death in old age happens suddenly, like a bolt from the blue. However, the truth is that the human body often gives unspoken signals and warnings months, and sometimes even a full year, before life reaches its final stage. The problem is that most people don't notice these signs because they seem insignificant at first glance. Only in retrospect do family members realize that all the clues were there from the beginning, but by then, it's too late to do anything or create those last, precious memories. This article will explore 5 key signs that often appear about a year before an elderly person passes away. Some of these may have already been noticed, but dismissed as part of the natural aging process. Others might seem like minor changes, but they actually signal a gradual decline in the body's vital functions. Recognizing these indicators early provides an opportunity to ensure the best possible care, cherish every meaningful moment, and most importantly, guarantee that a loved one's final stage of life is filled with comfort, dignity, and peace. Understanding what is happening can help people prepare both emotionally and practically for what lies ahead, and make the most of the time remaining with those they love. 1. Significant weight loss. One of the earliest and most telling indicators that a person may be approaching their final year of life is unintentional weight loss. Initially, this might manifest subtly: a belt that suddenly needs tightening, clothes that begin to fit too loosely, or a once robust appetite that gradually fades. Many families tend to explain this phenomenon as part of the natural aging process, but in reality, weight loss without apparent effort is rarely a benign sign. It often indicates that the body is no longer absorbing nutrients as effectively, muscle mass is steadily decreasing, and vital systems are slowing down. While aging certainly leads to some muscle tissue loss, when this process occurs too rapidly, it signals deeper internal changes. The body may struggle to properly digest food, or the person might stop effectively absorbing protein, leading to muscle atrophy. This loss of strength not only makes movement difficult, but also significantly increases the risk of falls, weakens the immune system, and makes the individual vulnerable to various infections. Another reason for weight loss in the last year of life is a change in appetite. Many elderly individuals simply stop feeling hungry as they once did. Their taste buds may dull, food becomes less enjoyable, and they might start skipping meals or eating much smaller portions. This isn't just a matter of preference, it's a physiological change. The body, sensing it's beginning to shut down, no longer signals the brain to seek food as frequently. The result is reduced energy levels, decreased physical strength, and a gradual decline in overall health. Underlying health conditions also play a significant role. Weight loss is a common symptom of chronic ailments like cancer, heart failure, or kidney failure, all of which can begin to progress long before more obvious symptoms appear. Even conditions like depression or cognitive impairment can lead to reduced food intake, creating a downward spiral where the body doesn't receive enough fuel to sustain itself. Some families try to address this by encouraging loved ones to eat more, offering favorite foods, or supplementing with protein drinks. But if weight continues to decline despite these efforts, it's important to recognize that the issue isn't solely about diet. The body is preparing for a deeper transition. At this stage, forcing large meals may not yield the desired results. Instead, focusing on comfort, easily digestible foods, and maintaining hydration can significantly improve their quality of life. If you observe substantial weight loss in an elderly relative, especially when they're eating less, feeling weak, or struggling to stay active, it's time to pay close attention. This isn't just about physical appearance. The body is sending an important message, and understanding it in a timely manner can help you prepare for the journey ahead with clarity, compassion, and the ability to imbue every remaining moment with profound meaning. 2. Extreme fatigue and weakness. One of the most evident changes in the year preceding the end of life is a profound, persistent exhaustion that doesn't disappear even after adequate rest. This isn't just mild tiredness after a busy day. It's an overwhelming weariness that turns even the simplest tasks into an unbearable burden. Getting out of bed becomes a true challenge. Moving across a room requires immense effort, and actions that once seemed routine, like preparing food, getting dressed, or even maintaining a conversation, begin to drain too much vital energy. This state is not merely a consequence of natural aging. It's a clear sign that the body is beginning to carefully conserve its remaining energy. As internal organ functions slow, the body begins to prioritize, directing resources to maintain the most critically vital systems. The heart pumps blood less efficiently, circulation weakens, and muscle tissues don't receive the same amount of oxygen. This is why many elderly individuals in their final months feel weak, unsteady, and unable to maintain the level of activity they once enjoyed. Another key factor is the slowing of metabolic processes. The body is designed to produce and expend energy, but as it prepares for its final phase, this energy is redirected. Instead of fueling movement, the body shifts into conservation mode. This is why someone in decline may start sleeping significantly more, needing longer naps, and struggling to stay awake for extended periods. Some may even experience sudden, sharp drops in energy, appearing normal one moment and completely exhausted the next. Perhaps the most heartbreaking part of this process is the emotional impact of fatigue. Many elderly individuals, who once prided themselves on their independence and activity, begin to feel deep disappointment or even embarrassment at their inability to perform familiar actions. They may withdraw from conversations, avoid social contact, or stop engaging in beloved hobbies, not because they no longer care, but because they simply lack the strength. This can lead to a vicious cycle of isolation, where they completely cease attempts to interact, which only accelerates their overall decline. For family members, watching a loved one transform from active and engaged to exhausted and withdrawn can be extremely painful. It's easy to mistakenly assume they're just being lazy or need to pull themselves together. But the reality is that forcing activity will not help. What's most important is to understand their physical and emotional limits, allow them to rest when needed, and make their remaining days as comfortable as possible. If you notice a loved one experiencing profound, persistent fatigue that doesn't improve with rest, accept this as a sign that their body is undergoing a serious transition. This is a time to cherish every interaction, create moments of peace, and support them without any expectations, because ultimately, what matters most is not how much they can do, but that they feel loved, understood, and at peace. 3. Increased cognitive impairment or detachment. As a person approaches the final stage of life, one of the most striking changes can be observed in how they think, communicate, and interact with others. You might notice that someone once sharp-minded and actively engaged begins to forget things more often, struggles to follow conversations, or appears disoriented even in familiar places. They may repeat the same phrases, forget names, or lose track of time, even if they never had memory problems before. These subtle cognitive shifts can manifest months or even a full year before passing away. This isn't merely typical age-related forgetfulness. The brain, like any other organ, requires a constant supply of oxygen and nutrients for adequate functioning. However, as circulation weakens and less oxygen reaches the brain, cognitive functions begin to steadily decline. The person may become easily confused, experience significant difficulty making decisions, or struggle to recognize people and places they've known for years. In some cases, they might even have brief periods of lucidity followed by sudden episodes of confusion, as if their mind seems to come and go. Another common sign is emotional detachment. A person nearing the end of life often loses interest in social interactions. You might notice them speaking less, engaging less actively in conversations, or spending long periods simply sitting in silence. It's not that they are indifferent to their loved ones. Rather, their brain is no longer processing emotions or sustaining engagement as it once did. Conversations become tiring, loud environments feel overwhelming, and ultimately, many elderly individuals retreat into their own world. You might also observe changes in mood and behavior. Some individuals become more irritable, anxious, or easily agitated. Others, conversely, may seem unusually placid, withdrawn, or indifferent to things that once held great significance for them. This isn't merely a personality change. It's often the result of the brain adapting to the body's overall decline. As cognitive functions slow, emotions become harder to express, and the person may stop reacting to situations as they once did. For family members, this stage can be particularly challenging. Watching a loved one lose touch with reality or emotionally withdraw can feel like losing them even before they truly pass away. But it's crucial to remember that this is not something they can control. Instead of trying to pull them back into active conversations, the best thing you can do is accept them where they are. Speak softly, offer reassurance and understanding, realizing that even if they don't always respond, they may still sense your presence. If a loved one becomes more forgetful, more confused, or less engaged, do not ignore these signs. They are often early indicators that the body and mind are preparing for a final transition. This is a time for patience, for cherishing quiet moments, and for focusing on cultivating an environment that feels safe, familiar, and peaceful, because even when words fade, love and comfort can still be felt. 4. Frequent infections and slow healing. As the body begins to decline, one of the most apparent physical signs is a waning immune system. You might notice that someone who rarely fell ill now seems to pick up every cold, flu, and minor infection that goes around. What used to be minor ailments now take much longer to recover from, and simple wounds, like a small cut or bruise, heal noticeably slower. These changes are not coincidental. They're signs that the body is no longer able to defend and repair itself as it once could. One of the biggest challenges is recurrent infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families assume these are just isolated illnesses, but when they start occurring frequently or take a long time to clear, it's often a sign that the body is losing its ability to fight back. Even antibiotics that once worked quickly may seem less effective. The person might require stronger medications, longer recovery periods, or multiple courses of treatment for infections that would once have been minor. This happens because as circulation slows and organ function declines, the body simply doesn't respond as well to treatment. Another overlooked issue is chronic wounds. If you notice that small scratches, sores, or bruises don't properly heal or constantly reopen, this can indicate compromised circulation. Poor blood flow means that oxygen and nutrients aren't reaching the skin and tissues effectively, making healing much slower than usual. Bed sores, especially for those who are less mobile, become a serious risk and can lead to dangerous infections if not carefully managed. What's even more concerning is that infections in the last year of life often don't present as we expect. Instead of a high fever, an elderly person might simply seem more tired than usual, more confused, or less interested in food. In fact, for older adults, a sudden decline in mental acuity is often the first warning sign of an infection, even before other symptoms appear. This is why early recognition of these changes can be crucial for how much comfort and support they receive in their final stage of life. For families, watching a loved one go through recurrent infections can be frustrating and heartbreaking. There's a temptation to push for aggressive treatment, hoping that another round of antibiotics or another hospitalization will solve the problem. But at a certain point, the focus often shifts from cure to comfort. Ensuring adequate hydration, keeping the skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another course of medication that only prolongs suffering. 5. Significant changes in breathing or circulation. One of the most telltale indicators that the human body is preparing for its final stage is noticeable, and sometimes dramatic, changes in breathing patterns and the functioning of the circulatory system. You might observe that a loved one begins to breathe more slowly or shallowly than before. Sometimes there are prolonged pauses between breaths, where their breathing may become extremely irregular, speeding up then unexpectedly slowing down. Some individuals exhibit a characteristic rhythmic breathing pattern known as Cheyne-Stokes respiration, where deep, rapid breaths alternate with long periods of apnea. These changes may begin subtly, but over time, they become increasingly pronounced and frequent, signaling profound physiological shifts. Another common sign is weakened peripheral circulation. You might notice that the extremities, hands, feet, and sometimes even the nose and ears become cold to the touch. The skin may take on a pale, bluish, or mottled appearance, especially pronounced around the fingers and toes. This happens because the body begins to prioritize blood flow to vital internal organs, reducing the supply to the extremities. Such a phenomenon is a clear indication that the heart is no longer able to pump blood with the same strength and efficiency. Some individuals also experience pronounced shortness of breath, even with minimal physical activity. Simply sitting, talking, or changing body position can cause them to struggle for breath or feel air hunger. You might notice them breathing through their mouth more often, or they may suddenly need to stop and catch their breath mid-conversation. If a person could once easily walk across a room but now struggles, it could indicate declining lung function. In some cases, fluid accumulation in the lungs can further impede breathing. This can cause a persistent cough, characteristic gurgling sounds, or even a feeling of chest tightness. Many tend to assume this is just congestion from a cold, but in elderly individuals nearing the end of life, it's often a sign of a weakening pulmonary system. This condition can make lying flat uncomfortable, and they may prefer to sleep propped up with pillows or in a chair to ease their breathing. For family members, observing these changes can be frightening and distressing. It's natural to want to help, to encourage deeper breaths, or to worry that something urgent and critical is happening. However, in many cases, this is simply the body's natural process of slowing down. There isn't always a way to reverse these changes, but there are always opportunities to make the person more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can significantly alleviate discomfort. In some instances, medications or oxygen therapy might provide relief, but the emphasis shifts to providing comfort rather than attempting to fully eliminate the problem. If you notice these signs, changes in breathing, cold extremities, or a bluish tint to the skin, pay close attention. These are often indicators that the body is conserving energy and that circulation is slowing. This is a time to be present, offer reassurance, and create a peaceful environment where they feel safe and calm. In these final months or weeks, the most important thing you can give them is not aggressive medical intervention, but comfort, dignity, and a knowledge that they are not alone on their journey. Final thoughts. In conclusion, let's recap the key aspects we've discussed in detail. Significant weight loss, extreme and debilitating fatigue, escalating cognitive impairment, frequent infections, and major changes in breathing patterns and circulation. These 5 signs often appear approximately a year before an elderly person passes away. They may not all manifest simultaneously or be obvious in their initial stages, but when you begin to notice them, it's an undeniable sign that the body is preparing for its final transition. For many families, these changes can be extremely difficult to accept. It's natural to want to fight them, to urge a loved one to eat more, move more actively, or overcome their exhaustion. However, sometimes the best thing we can do is to listen carefully to what their body is telling them. Instead of trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and profoundly meaningful as possible. Understanding these signs is not about fearing death, but rather about conscious readiness for it. When you recognize these changes early, you gain the opportunity to offer the best possible care, make important decisions in advance, and ensure that your loved one's final months are filled with love, dignity, and peace. This is an invaluable time to cherish every moment, share the stories that bind you, and let them know they are valued and will never be alone on their journey. If you notice these signs in someone close to you, take a deep breath and remember, you are not alone on this challenging but important journey. Many families have walked this path before, and while it's never easy, knowing what to expect can help you find inner strength patience, and peace during this difficult period.